Oh, it was the printer.
It was, yeah.
It was the
But
printer.
we've got stuff, but you're going to prompt us, right? Are we on?
We're on.
Oh, hi. Hi. Guess what, guys? We're so excited. It's She Speaks. It's She Speaks. It's our February 1. But I'm most excited that Maribeth is back. She was on vacation, and yeah, it was not right. You're not allowed to leave that long.
Oh, it's not right anymore.
You can't leave that long.
It was a long time away, but it was a good vacation.
It was. But so excited to have you back. I really am. I'm glad you had a great time, but you were definitely missed.
Thanks.
And thank you for joining She Speaks.
Was it optional?
No.
No. Yeah.
But we can pretend.
Yeah.
So, tonight we're talking about self-advocacy. That's a hard word for me to say. In the healthcare arena.
Yeah.
So, people
Excellent
listening,
topic.
it is a good topic.
Mm-hmm.
If y'all have any specific questions, as always, just make sure you pop them up in the chat and we will...
What does that mean, though? Self-advocacy.
It's a good question. Good start.
It's a really good start. Can I take this one?
Yeah, go for it.
So, self-advocacy, because I was reading through our little prompt questions earlier today. Self-advocacy, probably all around, but specific to the medical community, really isn't being the biggest pain in the butt that you can be. What it is making sure that you and your physician are a team and you partner in your healthcare. So self-advocacy means you're able to ask questions. You can have the expectation of answers, and answers in terms that you understand, not in medicalese that, just flies over your head. But self-advocacy is the ability of a patient to come into a medical arena or a physical therapy arena and have the expectation of being heard, being seen, and being able to understand and being a key player in the team of medicine.
And team, I like that you use
Team.
that, because it's
Team.
very much a partnership.
Right.
It is not, I think in the past, and I would say this for the older generation, they're now 80s, 90s, it was very much the doctor said so, and it wasn't as much of a team.
Well,
And now I think we converse a little bit more.
Yeah, because I could be, from a medical standpoint, I could be the smartest person in the room, but my skills and my knowledge base don't mean a darn thing if I am not able to listen to the patient who has all of the information. So it really is a team, and everybody brings their own piece of the pie.
Don't make me
Everyone
hungry.
brings their own piece of the pie, and the pie is not complete unless everyone is there and engaged in the process. So, team.
Yeah, exactly. And it can be challenging, though. I mean, I think I have trouble speaking up for myself sometimes in those situations, because, yes, that person typically does know more than I do, and I'm there for help. And so sometimes I struggle to kind of, when I don't agree or want more information, to ask. And I think that can be hard. I won't always push the envelope or ask the extra
What do you
question.
think some of those barriers are to people being advocates for themselves?
Well, I think sometimes they're internal and sometimes they're external. I think the internal ones are, we don't want to be seen as the problem patient, because if you ask a lot of questions, then are you going to be labeled problematic? Are you going to be brushed off? Are you going to be difficult?
Right.
Just all those things that, and I think, especially for women, we don't want to be labeled like that person, that difficult woman. Oh, here she comes.
Sure, yeah.
I think there's just some also, insecurities around, you already don't feel good, and then you're kind of going, is this in my head? Is this really true? Particularly around perimenopause, because you feel a little crazy. I'm not going to lie. Like, you feel a little nuts, like, is this really what's going on right now? And so you start to self-doubt, you start to question.
So, insecurities and difference in authority. There should be no authority within the room.
There should
be
be,
honest.
but it feels like it.
Yeah.
You've got the white coat part, so to speak, of this person did that.
The last white coat I wore was 26
I know,
years ago.
I haven't worn one since PG school, but
It's never my color.
I don't like them. But there is that sort of, you kind of defer to that person.
Yes,
And so I think you can sometimes be, hesitant. I think that's more internal. The external can be time constraints, like you feel rushed. I mean, it's a lot of times nowadays doctors are in, out, 10 minutes, and like you don't have time to answer questions.
I think 7 is the average.
Is it? I know now too, there's been some changes.
Different times in different specialties, but in a primary care setting,
Yeah,
I do
primary
think
care
7
setting.
minutes is the right.
Well, and then some of them change too, that if you bring up something that's unrelated to why you're there, it's like a second copay.
So
and
insurance
so,
issues,
You
yeah.
start to have all these fears of, well, if I say this, then it's going to charge me this, and so you don't always know. And then some of it is to be honest, I think sometimes in the frazzled, rushed state that medical providers are in, sometimes they're just not approachable.
But
I was going
to add to that. You've chosen the wrong provider because you will run up against some professionals that don't buy into the team approach, and so they add to that insecurity.
Yes.
They just feed those insecurities. So there's a lot of components, but
What
I
would you
don't
add
think
to that? Anything to-
the other thing I was thinking, because you mentioned it within terms of the older population, I think it had been so rigidly established years ago, decades ago,
it's been a while.
that the doctor knows all, and you never question the doctor because the doctor knows.
Yes, they know what to do.
And that's not always the case.
Agreed.
Right.
Yeah.
I mean, the doctor may know a few things, but if you add in, oh, by the way, I have lost 30 pounds, or it may shift completely what that doctor has to say.
Yeah.
So the best medical care can be delivered when both components, both people, physician and patient, are being open and honest and getting the information out there.
Yeah. But it can just be challenging. I mean, I think it can be challenging just
Tricky.
in terms of the time constraints that you're sometimes under, and just, and sometimes there's too much to talk about. There's so much going on. How do you know what to pick?
So what are your feeling on lists? Because
I love a list.
I love a list too.
And
Now-
patients always seem very hesitant when they bring out,
I like a
they
list.
write it down here, they have it on their phone, and if I see someone with a list, I'm like jumping up and down.
Figure
Quick
it
and
out.
efficient.
It is the
That's
most efficient
Yes.
use of your time. And you don't forget anything, you're not left with those insecurities.
Yes. You
And
make
that-
sure you got it. Yes.
That may be a list of symptoms, it may be a list of questions.
I even like, I don't know.
I really like when people bring in a list of good books to read
Yeah.
too. That's a whole other aside.
Yes, books, movies, what to watch. Yeah, I love a list because it helps you when you're in a more, I don't want to say calm, that's not the right word I'm looking for, but more thoughtful. When
Yeah,
you're able to think.
it makes you put your
Yeah.
brain in order before you ever walk into the
Yeah.
room, so then those other
You don't forget.
insecurities or your whatever else plays into it, time constraint,
Yeah.
you can
You
be...
start to feel
Bam,
rushed.
bam,
You can
bam.
be like, oh, but these are the ones that really matter. Yeah, I love a list. I love it when they come. And
How do you
ask
feel about a
questions.
Google packet?
What's a Google? What do you mean a Google?
You've never been in a room where people brought in and said, I looked this up on Google.
Oh, well, they don't show me a packet, but they
Oh,
do
yeah.
tell me. I
My
looked
biggest
it
one
up.
yet was an inch and a half. Granted, that was about 20 years
This is
ago
not
when I was in New
printed out,
Hampshire.
right?
Oh yeah,
Oh,
inch
yeah,
and a half.
That's never happened.
I would like you to read this.
No, I've never had that happen.
Never yet.
No.
I will say, honestly
I don't
speaking, I have mixed reviews on that. If you can read through an inch and a half of papers and condense that down to a bullet point on your list, I'm all about talking about that. But please do not have that has nothing to do with self-advocacy. Bringing a ream of paper and expecting me to read that, because then you're just wasting your time.
Yeah, we can't. No, I've never had that happen.
I am on a lighter
Please don't
note,
do that to me.
If you don't bring a ream of paper, how do you feel about it? Because I frequently get people who say, well, I saw this on Google, or I saw this on TikTok. Right.
Yeah, I get that all the time. It's self-diagnosis, especially because I think sometimes it's a little easier with physical therapy because you can type in right shoulder pain and you're going to get a pop-up list.
But I think in one respect, it helps people be self-advocates.
It does.
Mhm.
I have mixed feelings.
But?
Yeah, I have mixed feelings. I like it because it can sometimes actually help them hone in on really what's bothering them. So they kind of come in and go, well, I was reading and then it said this, but I don't really have that. And they can kind of start to help me with the whole differential diagnosis and sort of figuring out what's going on.
I love it as a jumping off
Yeah,
point.
and then I can dig in a little more, but then there are times where I really don't like it because there are times where they'll get very stuck in their head of this is what's wrong with me, and Google said it, and I should do this, and this should work. Because there's a lot of that. If you do this every day, in 5 days you'll be pain-free, and they're trying, no, it doesn't work like that.
Yeah, that's why I say I like it as a
So-
jumping off point, because I do love when people have kind of introspection, that's a big word, but have thought about it enough or seen something that they relate to, that it's a point of conversation that you can start there.
Yeah.
But knowing, again, it has to be flexible on both sides.
It does.
But it's
yes.
a great place to start, and I think it makes it, especially with social media and everything these days, it makes it a way of starting that whole self-application.
Yeah.
Okay, so you guys like lists. What about if somebody's taking notes?
I'm fine with that. Heck
Love
yeah.
a note. Not a fan of video.
Yeah, no, I don't. No.
No,
But-
I like notes.
I think taking
Either notes or bring somebody with you.
I think that's huge. Well, I think it's huge. I think notes are great because you're not going to remember everything.
Absolutely.
Ever. ever. And you may end up developing questions later, and then you can kind of look back at your notes and know that and realize it was answered, or it wasn't answered. I need to reach out and have this answered. I love that. I think having someone come with you is just kind of dependent upon the situation and your comfort level with it, but I think it's good because and the person, you have to have the right person. But obviously, if you're going to have some type of surgery where you're coming out of it and you're not going to remember anything, you need someone sitting there.
I like a friend, so to speak, for a second set of ears. It crosses the line when that friend then monopolizes the appointment.
Yeah, you do it. Oh, that's
and whether it's a friend or a spouse or a parent or if you've got your backup singer, fantastic.
Yeah.
But if you've got someone that needs center stage, and you don't always know that. I mean, to be frank, you don't always know that. But another set of ears. Any way of reconfirming or trying to remember your best bet, or trying to remember the information you're given.
Because sometimes it's a lot.
Well, my appointments are an hour long. We talk a lot.
Yeah, same. And I will say, good point about on the flip side of the person that might monopolize the conversation. For me, sometimes it's beneficial, particularly when it's younger individuals that are having the problem. The parents sometimes notice things that the child may not have, and they can say, well, but during sports I noticed this, or when they were doing XYZ, because sometimes kids are not, and I mean typically middle school and younger, don't always have the words to explain what's going on, or they aren't paying attention like their parents might be. So sometimes it can be helpful, but also then letting the child speak and not having the parent tell.
There's a nuance there.
Yeah,
I find it helpful on the flip side, especially in my more traditional practice for many years. Someone with an older patient as well, it helps keep that older patient.
Yes.
Kind of for similar reasons.
Yes.
I don't want to say child, but like an adult child of an older person will notice things, but it also helps keep the older person kind of on track.
Yes,
too.
they can veer.
Yeah. it all on that. I mean, the final answer is it all depends on the purpose. It can be very beneficial, and then it can
derail.
Too. Yeah,
it can turn into some interesting when they start fighting in front of you. That's always fun.
Where's the Pokemon?
Oh dear.
No. I'll have to start keeping some around. But
So one of the questions that got sent in was second opinions.
Oh, huge!
What?
I love
Second
a second opinion.
opinions.
Right? But people are afraid.
Love to give second opinions,
Yes.
and love people to get second opinions
Yes.
on what I tell them.
100%.
I'm not bad.
So you're not offended.
Not ever. No.
Oh, I love information.
Yeah.
More information, the better.
But I think that comes back to the feeling like offending someone. You don't want to hurt their feelings. You don't want to be that person, that difficult client. But man, you got to advocate for yourself. And like you said earlier, the doctor doesn't know everything. And so as a professional, if they think, as a professional, I have to be willing to admit I don't.
Yeah.
And as the consumer, I have to be able to realize that every doctor is not going to know everything. A GP isn't going to know the same thing as an ortho, is going to know the same thing as a neuro, like all that stuff. So yeah, man, I want you to get a second opinion. Especially before you make a big choice.
I was going to say, just as one example, I obviously would talk to a lot of people about surgery when I was in my operating years. And surgery is a big step.
Yeah.
Therapy is a big step.
Yeah.
I mean, and so whether it's big or little, they're smaller, but let's take surgery, for example. If someone wanted a second opinion on that, I am all for making that happen, because if you're doing something as big as a surgery, you better be fully committed and fully understand everything. Yeah. And the more information, the better.
100%.
One more time for those in the back. Second opinion. Good.
And third opinions are good too.
On. Yeah.
I mean, there's a point where you kind of have to make a decision, but yes, you've got to be confident in that decision. You can't go into it wondering.
I think a lot of times people search out for second opinions or search out second opinions because they haven't gotten enough information in the first opinion.
Agreed.
And so it's not so much that they want a contradiction. Two reasons I see people. They don't want a contradiction of the original diagnosis. They just want a better explanation.
They want to understand it,
And or the first diagnosis wasn't what they wanted.
Yeah.
And so they keep shopping around to find somebody that will tell them what they want to hear, which is...
But as your own advocate, you have to know why you're going and doing it.
Yeah.
So be honest with yourself.
But if you see 5 opinions and they're all the same.
Yeah. Yeah, maybe. But yeah, just be honest with yourself why you want it, and like even if you don't say it to anybody, if you're looking because you Googled it and you think it's this and no one's telling you that, then you have to be honest with yourself about why you're looking for it, and maybe that's not what it is, or maybe it is.
And maybe you just ask that question. No, Google told me this. And honestly, like I might kind of smile at you, but I will never be offended
I'm not.
when someone brings up even something that I might consider crazy, because I am a huge advocate for patient education and self-advocation so that you get the answers you need.
100%.
So as providers, you know that you say something, and the first thing people do is they race home and they look it up, and worst case scenario.
Oh, I spell things out and write it down for them.
I do too. I'll give you a Post-it.
So that's okay?
Yeah. As long as if they find something that either agrees with what I've told them, or if it's contradictory, that they give me the benefit of
Reaching
explaining.
out. Yeah.
Right.
Yeah. Because sometimes there's just a miscommunication or misunderstanding.
Or there's a couple times.
Yeah.
What is it? 2 ways to skin a cat?
Yes.
Yeah. There's, medicine in particular is an art form.
It is very much, yeah.
So,
It is.
practice.
We're practicing.
Mm-hmm.
We don't
There's
know
no
all the
magic
answers.
wand.
No, I wish.
Oh,
there
I
was.
wish mine's broken.
I know.
I mean, I have a Harry Potter wand.
I do too. Which one do you have?
I have the one for my date of birth. I got mine for me.
Oh, I didn't know there was a date of birth one.
Yes, when you go there, they can pick them out. For
I
you.
have Luna
I got mine
because it was pretty.
No, mine is for
I have Luna Lovegood.
the guy picked it out like based on my date of birth and some
Oh,
other
that's
questions he asked
awesome.
me, and then he gave it to me. And
I had no idea.
it doesn't do magic like that though. Darn it. But I like it.
There's an upcharge for that.
Yeah. I didn't have the money for that one. Just the wand.
So we're left with our knowledge base. Okay.
So when the magic wand does not work, and you got somebody that you just is a head scratcher.
I mean, I actually kind of like those. I tend to enjoy
You
a
do.
little bit more of a difficult case. I like to use my brain.
You like to research.
I do like to research, but I can also get stuck in a research hole because research is there's so much out there, and you'll find just as much that says one thing it contradicts and another that contradicts. So maybe you have to critical thinking skills here, but those I do enjoy those cases, but that's where I every time start my evaluation out with, I need you to tell me as much as possible. Don't hold back. Like any little thing can help me, and I am not going to be upset with you if we spend this whole time talking. And that can be difficult because people are very used to rushing through, and they forget. And sometimes those little nuggets are in there of
the
the
nuggets
little
sometimes
things.
come out in the most inane ways.
They
too.
do, and it's almost like that train of thought. So I want you to come in with your list. I want you to come in with your medical notes. I may not be able to read them right then, and a lot of times I don't want to. I want to hear you first before I have any
Before
bias.
I look at anything else.
Yeah, I don't want to see an X-ray, an MRI. Like I don't want
Fresh
to
eyes.
have my what I'm hearing biased by a result.
Well, because that's what they're asking.
But I look at it later.
In terms of a second opinion, they're asking for fresh eyes.
Yeah.
So if I've reviewed everything you
Yeah.
sent ahead,
Yeah.
I'm not giving you what you've asked for.
And I will also say that those I always take imaging with a grain of salt in physical therapy world because images don't correlate to pain. So you may come in and be like, your doctor said you had a herniated disc here and you've got a rotator cuff here and blah blah blah. I don't care because there's so much research that shows that none of that matters.
Talk to me and tell me what you probably
Yeah, I want to hear because I don't care if you image shows a rotator cuff tear. You may actually have something completely different. It may be coming from your neck. So those are things that I want to hear as much as possible. But I love when they come in and have that information. But let me hear you out first, and then we can dig into the other stuff.
I will add to that. I too love a head scratcher.
I know you do. You
Yeah, we
both love
do.
it.
Yeah.
We do.
We do.
But I will also tell you, and I speak for Pauline too. Don't smack me, but both of we like head scratchers, but we both have a very healthy understanding of what our limitations are.
Yes.
So if we get a head scratcher that we can't figure out, we are more than willing,
tell you I don't
helpful, that we'll get you where you need to be. I don't know that that is across the board. I mean, there's
I think that's real.
you heard it here. There's some large egos in the medical community.
Yes, as a general rule.
So I don't think everyone has that feeling, but yeah, head scratchers.
It can be challenging. Yeah, it can be challenging. But yes, I
And a lot of times they're multifaceted, so it might be
There
more
is,
than.
It very often is, more than one thing. They can be layered.
And that's where the conversation becomes so important.
It does.
Because it's through conversation about your daily, your day-to-day activities, your intake, that you find all these small little nuggets that you start being able to pull those multifacets together.
But like you said, with that, you have to. But we will help get you where you need to be. But you have to be willing to say
know
I
it's
don't
not going to
know.
happen in
Well,
7 minutes.
Yeah, but you have to, like, I've worked, I've been in the industry for 20 plus years. You have to be willing to say I don't know, and that can be difficult in different positions that you're in, different workplaces, things like that. How you
It'll
are.
be 30 years for me this year.
Will it really? Mine's I'm over 20. Going on 21. But
You got a whole
when
lot of
I-
experience behind you.
but that helps with our patterning and recognition. But when I was younger, I didn't always have the confidence to say I didn't know, which sounds weird. But to say I don't
it's more
know,
important than your knowledge base.
yeah. But to say I don't know takes a lot of confidence, and you don't have that when you're first starting out. I have now going on 21 years under my belt. I will tell you if I don't know. I might try to figure it out,
Well,
but I'm happy to say I don't know.
Fix a lack of knowledge. I mean, there's a cure for that. There is not a cure for overstepping your limitation.
Yes. But that was I will say that was one of the things I had to learn growing up as a provider, was being able to be like, you know what, I really don't know. I have no idea.
Get your feet under you. Yeah.
And just, but now I'm quite comfortable doing that, and I'll tell someone, I don't know, we can try these things. There's going to be a point where I look at you and tell you, we got to find something
My
else.
answers are usually, I don't know, but I'm going to look into it. We're going to find an answer. Or, I don't know, and I'm never going to know. So let me get you to the next person who will. Yeah.
I think that's great.
I have
Teamwork.
a third.
Again,
That's how we started.
I have a third one. Sometimes mine's I don't know, but we really don't need to know as long as you're feeling better. It works. It's true.
I'm not even saying that.
Right?
Yeah.
You feeling better? Okay, we don't need to know.
That's why I'm
Moving
starting
on.
goals. Our goals are set, so it doesn't matter that you've got hair growing on that part of your body. I don't know.
Check it out. We got wax.
So I think we're digressing from patient
Yeah,
advocation.
sorry.
I think people have started to expect that from you now.
Probably. That's fair. Well, we're on the provider end of the self-advocacy, saying that you need to look at your provider, and if they're not willing to have these conversations or say, I don't know, they might not be the best provider for you. So it's sort of loosely ties in.
I think all patients should advocate for themselves. There are varying degrees of what patients need to do.
Yeah.
Does that make sense?
Yeah.
Like I have a couple patients who don't want to have a long conversation with me, but they also don't have very many issues. They come in, we address their issues, and they're gone. And that's fine. They are getting the care that they want. Now, on the flip side of that, I have a lot of patients who come in with a ton of questions, and I'm equally as happy to see those folks. At the end of the day, if your medical provider is meeting you and your needs, then you have advocated appropriately for yourself, wherever that falls on the spectrum.
So not all relationships are meant to be.
Mm-hmm.
What if you have somebody that is just not
never.
clicking?
It's not clicking.
Never click. Oh, no.
No,
There might be one or two.
No.
That
It happens.
over the span of those 30 years.
Right.
Yeah.
Obviously,
You
none of
never
them are
have one.
current.
But I was not sad to see not come back. No, but to your point, in all sincerity, it is a team approach, and I'm sure we've all been on teams in our lives, whether it's work related or sports related, where you didn't really get along with your teammate.
Right.
Same way with medical professional.
Do you stick it out? Do
I
you
am not
say,
a-
I don't think I'm the person for you?
Pauline and I differ on this
Yeah.
because she's got a little bit more chutzpah than I do. I usually try to make, it has been a rare occasion that I have had to terminate a physician-patient relationship. I usually continue to practice medicine and try to meet them where their needs are and let them realize their needs are not being met. And so they self-attrition, what's the word?
Yeah.
They go away on their own. I tend more to be that way. Pauline, on the other hand, is very good about
I'm a little more
boundaries. Yeah.
I'm
And I'm not going to, I've heard you say it to people, I'm not going to be, I don't think
I'm
I'm
not
the
the
person to
person
help
for
you.
you.
Right.
And I have heard you say that, and I respect that.
Yeah.
And it's done very pleasantly.
Yeah, I try not to be
It's
mean
not
about it,
offensive
but
at all, no.
there are, and I think some of that comes back to the relationships are also different with different kind of practitioners. As a physical therapist, or even on my personal training side, my coaching side, you're going to be with me a lot longer than just one visit every so often. Like, you tend to be with me for a longer stretch of time, potentially weeks to months in physical therapy, and if it can evolve. You want that person to really click with you, because that's a longer term relationship than I'm just going to go to a neurologist once.
Right.
You know, you may not like their bedside manner.
It leads to
whatever.
better everything that we've already just talked about. It leads to better conversation, better communication. It leads to a better relationship where they feel equally as open and comfortable.
You got to be able to talk to the person. So I don't have a problem in a polite way saying the way I work is not going to work, and it's more about the way I work isn't going to work for them. They're going to ask me for things that I know I can't deliver, or it's not the way that I treat, and I have learned over the years to just be very comfortable with the way that I treat people, and I'm not gonna.
There are no bad. I mean, I think there are no bad patients.
No, there's no bad patients.
There is just a mismatch in
what they need versus what I can give. So yeah, I very much will just say, I don't think I'm the right person for you. Here's where I would send you. I always try to have an alternative though.
Right.
But I've luckily not had to do that very often. I have had to let some clients go, and usually it's a conversation. I'm very open with why. I don't ever just stop seeing someone. I will give them a reason why. Like, usually if it's the way I treat, or they want a very specific thing that either I can't do or don't agree with that they need, or I'm always very open about why. I'm not just going to be like, nope, bye. But I think,
been tempted.
I mean, there are days, they just want to be like, no. But I want them to know why, and then that helps them then decide where they're going to go afterward if I don't have a resource. Because sometimes I don't. Like, if it's someone in another state or something, I don't always have a.
I mean, it keeps us honest to why we do what we do, which is, at the end of the day, you want the patient to feel better. You want them to have this pain or whatever.
Yeah.
And recognizing that I'm not an end to that goal.
Yeah. I always tell people, I'm not everybody's cup of tea.
Yeah.
I'm not going to be. But I also will tell my clients that too, though. If you don't like me, like, it's fine. If you don't feel comfortable telling me, tell someone else, but get off my schedule. Like, seriously, like, I'm not being mean about it, but you have to like me and trust me and want to hear from me. If you don't, you need to see someone else.
So on the cup of tea note.
Yeah. A spot of tea.
Today being my first day back from vacation, it's been a little fatiguing. So I dropped my pen. It happened to be my favorite pen on the floor. And so instead of just picking up another pen like any normal individual would do, I got on the floor and crawled around.
No, that's what I would do. That's what.
And
it's
then
your favorite
stopped
pen.
and looked up at the patient's face.
I would have done the same thing.
And it was only in that moment that I went, So I asked, have you ever been in a situation like this where your doctor's crawling around on the floor? She's like, no. Are you okay with it? I said, She said, I'm like, okay. So on the cup of tea, thought, yeah.
You gotta know your boundaries.
You gotta know your boundaries. But it was my favorite.
The fact that you act like, the part of that gets me is in my brain, I was following you. Like, I would not have reached for another pen. I would have been on the floor getting my favorite pen.
Sitting on the desk.
I would, yeah. No.
I'm like, oh, that's my favorite pen.
I was distracted. And this is why we're friends.
There is a reason that we are, get along so well. Anyway, sorry, that was a diversion too. But
Oh my god.
So if you're gonna be offended by that, don't come see me.
you don't always get that kind of entertainment just on post-vacation day.
It's always here. But yeah, you gotta have that. Yeah, it doesn't work if you don't. If you can't trust who you're working with.
Yeah.
I mean,
Don't
really.
set yourself up to fail.
Yeah, because
Yeah.
I mean, it's not gonna work.
Totally.
You're gonna be unhappy with the outcome if you are struggling with the relationship.
But in particular with the head scratchers.
Yeah.
Oh, yeah.
Yeah, because they're probably already. I mean, they've already been through a lot.
Because the relationship aspect of
Yeah.
that from a provider-patient standpoint is so much more important
Yes.
on a head scratcher than it is with a simple.
Yeah, because they've often been passed around, not told that no one can help them. They're very defeated. Like, yeah, you gotta trust that person is not wasting your time, because you've already wasted potentially years trying to get the diagnosis or help.
I might laugh while I'm helping you, but I'll help you.
Heck yeah. That'd be fun.
With my favorite pen in hand.
While crawling on the floor to find it.
And I'm picturing because your office is not that big.
Oh, I found a pen.
Oh, okay, good. Okay, so with the two of you, you practice a little differently than the rest of the world. Do people have to? Can people advocate for themselves? Call you up like?
Yeah,
Don't need to go to a doctor, get a referral for anything.
For me,
I'm
no.
not following.
People can just call if they want to come. They don't
No,
need a referral or
absolutely.
anything.
It's my favorite. It's a category on my what kind of office appointment you want. It's the medical mystery. I can't remember what I call it now.
Oh, I love
It's
that.
but it's basically a hodgepodge of if you don't know, you have a question, but you don't even know where to start asking the question. I'm happy to answer that. Again, I might not be the one, but we can at least get you in the right path.
Yeah.
Like if you've got a cracked skull, I'm probably not the one, but I can point you in the right direction. So no, absolutely.
Well, some I think that's more like some providers have to have a referral. So
Yeah.
like you need a referral to a neuro.
Oh yeah, no referrals
From
needed.
your GP
Right.
or something. Physical therapy has in the past used to require a referral from your doctor.
Mhm.
So, but that has since changed. Most states, it varies by state, but North Carolina is a direct access state, meaning you do not have to go to anyone, a GP, ortho, anyone, to get a referral for physical therapy. You can walk in off the street. The nuance there is that it just depends on your insurance provider. So if you are going to then try to submit to your insurance for out-of-network benefits, they may say you have to have a referral.
Yeah.
So you just have to know what your insurance is saying. But as a state law, there's no requirement. And if you're going to pay out of pocket and not file your insurance
the
at all,
requirements
no.
are usually insurance based,
Yeah.
but no, you
But
don't
I-
have to. Now that I understand where the question's coming from, yes, no, you don't need a referral.
Not for physical therapy, and not for you.
And sometimes it is a simple phone call.
Yep.
I got a cracked skull. What do I do? I can point you in the direction. Sometimes it's not as easy as a. You don't always have to have a visit, but sometimes it's not as easy as a yes or no question. And I'm going to see you in the office,
Yeah.
kind of thing.
It's always better. But yeah, you can just call and
Mhm.
and yeah, get right in.
Get in, start. It's a good
Yeah.
starting place.
It's a good starting place, yeah. And like Maribeth, sometimes it's a quick, like I call just a phone call, I call them a discovery call, where it's just you're trying to figure out,
Are you the right fit?
is this the right fit?
Right.
That can be a quick, because there's some things that I, as a physical therapist, I don't specialize in. So if you call me and say, I've got vestibular issues and I'm so dizzy all the time and I'm throwing up, I'm not going to see you because I don't do that. And that's a quick call for me to go, you're going to go here.
Okay.
But other times it can be a little bit more like, well, I'm dealing with this, and this, can you help me? And then that's going to be potentially like, then I want to see you in the clinic, because then it's a little bit more, I got to find out more information.
Right.
But a phone call's not going to be a bad place to start.
Okay. Okay, as providers, is there any tips or tricks or things that you do because you are providers when you
Oh,
have
we
an
go?
appointment?
Oh.
I'll go with a list.
There you go.
Oh, yeah, absolutely go with the list. And with the mantra that there's no stupid question. So, and I say that because, having been, I'm trying to think of the last time I went in as the stupid one in the room. I know OBGYN. I don't know everything else. So I go in with a list of questions. I go in with the mantra that there's no stupid questions. And I go in with the expectation that when I leave, I will have a better understanding of what that encounter meant. Like that's my baseline requirements for any kind of office visit. Whether or not I know what's going on, or it's something brand new, like a neuro consult or a cancer diagnosis. Those are my 3 non-negotiables.
Better understanding. I love that.
That's my baseline expectation is I'm going to leave with a better understanding. And if they haven't accomplished that, then they need to get me to whoever that's going to get those
And
answers.
it's a great thing.
I always go in doing my best not to let them know I have any medical background.
Under the radar.
Oh,
I don't let them
wow.
know. Yeah, I don't. I usually, I won't, put on there what my profession is.
Yeah.
I don't use any of identifiers, because I have had
They
at
talk to you
times
differently.
they do, and
Mhm.
sometimes, like you said, I'm very knowledgeable in my area. That doesn't mean I know everything.
Mm-mm.
And so I've gone into appointments and been almost more confused leaving because they talk to me in a way that, like, oh, you know all this. No, I don't. I don't know any of that. So I usually
If
try
I
to
get a
stay.
hint that that's going on, I say stop there and talk to me like I'm an idiot.
Yeah.
I mean, like,
I've done that too. I'm like,
Yeah.
yeah.
and not in a
Talk to me
kind
like
of way, but yeah,
Yeah,
talk to me
don't
like I
worry.
know nothing.
I wouldn't
But
have even thought that. Wow.
But no, that's why I go in completely. I try not to say anything, and even let them know because I want to see. And sometimes that's me, like, also, it's not testing the person, but, like, I want to know if I'm going to get along with this person as my doctor, and especially if it's a long-term, like a GP or someone, or OBGYN or somebody that I know I'm going to be seeing for a long period of time. I want to see how they interact with me in that manner.
I've even said that to you when I've come for some issues in your wonderful fund of knowledge. I'm like, oh, hold up.
Yeah, you have. Yeah.
My shoulder's not working. Can we dial it back and tell me why?
And I try to always, and I'm aware that sometimes I get excited, and I'll throw words around, and I'll be like, if there's anything that you don't understand, stop me and ask. Like, I will tell clients to do that.
I try to be cognizant too, because there's a look that people. I mean,
Yeah.
even as not, there's a look people get in their face that you're like, oh,
Let me backtrack. Yeah.
hold up a sec.
Yeah.
I mean, I try to
When
be,
you geek out,
yeah,
Yeah,
that,
I do.
Yeah.
okay, and I admit full nerddom and
Yeah, I do sometimes. I can't help it. I get really excited.
you do. It's funny.
It is funny. It's certain things too. I do. It's just like, just stop right there. Calm down.
anyway. Any other questions?
I know.
I was like,
Between the pat on the floor and, the geekdom here, it's
I
hard.
think
I feel like this is a little bit of a confessional.
maybe a little bit. We're like on those reality shows from the 90s.
Oh, jeez.
What was it? Real World?
Yeah.
Oh, watch- yeah. Is
Is
that
that
to
the
go
one that
in
was on
MTV?
MTV?
And they had
Yeah.
to go into the confessional booths and stuff?
Yes.
We could start that here.
No, we could not.
Oh my gosh, no.
Yeah.
No.
It might be funny though.
You'll note. We'll give a shout out to Kim. You'll notice that Kim Morris is not with us this
She
evening.
is not.
And we miss her.
We miss
do
her.
miss
though.
her greatly.
'Cause I think she would have some good things to say about, like, how you could
absolutely, yeah.
mentally prepare for some diagnoses that you might.
But she would not be on board with the confessional.
No, she would not. No, she would not.
We miss her, but yes,
I don't
because I think
so.
she would. And a lot of things I think she would probably align with us, but she might. Well, I definitely know she would have some different thoughts on how to advocate for yourself.
So you can always still ask questions, and we can get them to her if we
Yes.
need to.
Yeah.
Yeah, if you have something specific for that.
So there was another question. How can a patient tell the difference between discomfort that's part of healing and a pain that shouldn't be ignored?
I mean, that's a good question.
Really kind of
And-
diverged from our original topic, but okay.
Like, do you set people
Well,
up for that? When
I do, and maybe
It's all
that's
about expectations. So
Yeah.
on that vein, yeah, it's about expectations.
yeah. But I think from, like, while you're, I think from a self-advocacy point on that is, and maybe I'm thinking of it from a don't let the person, the provider, kind of
Tell you
talk
what
you
hurts
out
and
of,
doesn't.
talk you out of what you're feeling, maybe. And so I will advise. I have some general rules, and it's more musculoskeletal pain. So it's going to be different when it's internal kind of stuff.
That's why the face.
Yeah, because it can be very different. A lot of times, though, and I think in some of the situations that you deal with, like, pain is a warning sign about something.
Yeah.
When it comes to musculoskeletal, it's not always a sign that anything's wrong. And so it's not saying that you're not feeling that pain or that it's not real. It's kind of like digging into, well, what does it feel like? And describe it for me, because there are, like, sharp stabbing pains or shooting pains. I always tell people are usually never okay. Doesn't mean anything's broken, doesn't mean you've done damage, but it's your body is very much telling you, I need attention. Dull, achy, throbby pain, that you can work through and isn't always as immediate as an urgent issue. But I want to hear about all of it. So I think it's more like they're not discounting that you're paying, but they are trying to figure out how urgent a certain thing is over another, what's more important. So
I'm going to tack on with that because I think it comes full circle with the way we both practice. there's no stupid question.
Yes.
So if it is bothersome enough to you, I don't necessarily want the patient to bear the brunt of whether it's important enough or not to see. Come in and ask.
Yeah.
Like, so again, you should have a team player in your medical relationship that you can come in, ask about the pain, walk away with a better understanding of why it's not an immediate concern, or walk away with a plan to fix the pain.
Yeah.
Like, I don't think the patient should have to necessarily decide that.
Right.
There's some general guidelines.
Yeah.
It's sharp, stabby versus, in the same way, again, my face was weird because it's not as clear cut from a medical standpoint.
That's different.
Because it's usually not just one symptom. If you tell me you've got pain in your belly, I'm going to ask you about a ton of other things. So it's not as clear cut. General rule of speaking, and my kids will testify to this: go to bed, either go to bed, eat something, or poop, and then let me know how you feel.
Heard it here first.
If it
does not apply to musculoskeletal.
If it's immediate and needs attention, it's not going to get better. So and whether that time frame is 15 minutes or an hour, if it is getting progressively worse, that needs to be attended to. If it is plateauing or getting better, it's probably not something that needs to be seen.
But advocate for yourself. Don't tough it out. Reach out.
I would never put that on.
Yeah.
I mean, I can mock my children for doing it, but I would never want them to try to figure that out. I was always okay with them coming to me and saying, whatever, this hurts or that hurts, and I would, I use my discretion.
But maybe that comes back to having a bad experience, and being a little nervous about, well, is this really a big issue? I think I can get it from that standpoint of, you might have been criticized for coming in, oh, this is nothing.
But that was the wrong person to be listening to you.
Yeah, but you didn't know it at the time. Now you may be hesitant, and I can see that. I've had clients come in and say, well, it's been going on for a while. Well, I didn't, and I'm just always asking questions. I'm never intending to be rude about anything. But I'll be, well, why didn't you get help until now? And it turns out when you dig a little, there's been some really bad experiences or being pushed off and sort of told it's just in your head.
Or you can get more of the story, because I usually phrase it, well, what was the deciding factor for going to the ER? What was the deciding factor that today, if this has been going on for 5 months, what today? And you get more of the story.
Yeah. So. But I would say if it bothers you, you need to bring it up.
Yeah. And then let somebody who has that knowledge base decide if it,
And I think it makes the patient feel better.
Mm-hmm.
Oh, I called and checked. And whatever. It's just, am I brave enough to call and check?
Yes, and that can be, you have to
feel like you're tough.
So we're back to the whole, you should feel comfortable enough being able to ask that question. Like, that shouldn't be a...
And maybe that jumped up. Maybe we struggle with that a little bit because that's not how we practice. Like, I'm that person, and I know you are too, that as they're leaving, if anything changes or you need me between now and the next appointment, call me, email me, message me on the portal. I will get back to you. I may not get it right that second, but I want you to, if an exercise I gave you seems to be making something worse, call me. Don't just suck it up and keep going. Yeah, stop, contact me. I want them. So I think maybe that went over my head because I want you to reach out. I don't ever feel like it's inappropriate for you to reach out to me and ask a question.
Well, because
so it's sort of, I didn't even think about it.
I mean, the reverse of that is if you just keep putting everything off, then you're not educating your patient, so they're not going to ever know anything different. I'm a huge, tell the patient, give them information, let them know what's going on, so that the next time they may have that, they don't have to sit there and worry and fret about calling me. They're going to know or not know. But if they don't do it initially, how do you ever learn anything?
Yeah. It's hard. I think it's a personality thing. I don't want to be a bother.
Yeah. Yes, that can be a big thing. Particularly, I think, for some of the harder cases that we work with, those multifactorial ones, I think they have felt very, I am a bother. And so sometimes it can be hard for them to want to open up.
Well, and that's part of the education too. I talk through expectations and a lot before, especially if I'm doing something or there's a plan of care in action. I try to lay out the different scenarios as I might see them, so that if something changes, they're going to have a baseline of understanding. You can't predict everything.
No, I wish I could.
Back to the magic wand again.
Back to magic wand.
Crystal ball, baby.
Oh, I love it.
I know those exist.
So
not accurate, but
and our notes that we made for this, we saw something about writing down questions, bringing in a list, and then Timeline of symptoms and medication list.
I love a good medication list.
I did not think it was going to go that way, that you would love it. And
Here's why. Not because I always, so some are because I want to know, like, are you taking a certain painkiller, muscle, like, what's working, what's not. For me, it's often, if they're willing to put that in, I know I'm going to get a lot of information and they're paying attention to stuff. If I get a nothing and they really are taking other things, I have to dig a little deeper, so I need to know how to approach that person. So that's what I like it for.
I like it from an information standpoint, but I don't always trust it.
Agreed, but it just shows me, like, how do I need to approach that person? Because sometimes, like, this may be a tangent, but as a provider, fill your intake paperwork out.
Oh my
Like,
gosh.
before. And the reason I say this is not, like, I think some people get frustrated with it because it feels like it's what you're asked all the time. But I legitimately prepare for my appointments. So I will print that out, and it starts to help me decide, what do I want to ask? What do I think is going on? I create a list in my head, or sometimes I write it out, old school, pen and paper. And it's called a differential diagnosis list, and I start to go, well, it could be X, Y, Z. What do I want to ask to see if it's this? What tests am I going to do? What am I going to measure? I will have that ready so that I can have a much more focused evaluation with you and not waste your time. If you don't fill it out and you got to take 10 or 15 minutes to do it, and then now we're down to 45 or whatever, and then now I have no idea and I'm looking at it really quick, I don't have a way to do that. Yes, I can think on my feet pretty quick, and yes, I can still get what I need, but it is much more focused and
less efficient.
Yeah, and so then that plays into too is how much information you give me. If you're skipping all of it, then it's just going to take me longer to figure out what's going on.
I use the paperwork as a jumping off point, because I've had some people say, well, it's repetitive, you're just asking me all those same questions. Did you not read my paperwork? Well, no, yes, I do read your paperwork.
Yes, I do.
I prepare for my visits too, but I use some of those points as a jumping off point for a better explanation.
Yes.
The medication list for
Instant.
The medication list is, you can get a world of information. You know, does the patient know what the medicine is and why they're taking it, or are they just taking it because? So I use it but it is vastly more helpful if you have it written down beforehand. And I love, back to your question, I love a timeline if it's possible. I even like a halfway timeline because it's, again, a jumping off point that you can put things in. Because when I take notes during a visit, I am creating a timeline. No one else could interpret it, mind you, but I am creating that timeline.
Don't look at my notes.
Because especially with the head scratchers, it is. It's probably one of the best pieces of information.
I love it. I think that nugget has made this whole show worth it. The intake paperwork.
Did we mention we prefer you to fill that out ahead of time?
Yes.
Well, I mean, I don't think people realize why.
More than 5 minutes beforehand.
Yeah. I don't think people realize why.
Yeah. I can't prepare.
Yeah, but no, I do. I think, and I know I've been on the other end where it does sometimes feel like I just filled this out and now you're asking me the same questions. I try not to ask. There are ones, though, for sure that I like pain numbers and stuff. They'll be like, well, I just answered that. Oh, but I'm going to dig a little deeper. They're, like you said, jumping off points. But most of the time, I'll just kind of be going through it and being like, well, you told me this. Anything else to add to that?
Yeah.
I'm reading it, but I need it because it just helps me do a better job for you.
Yeah.
And then I can go in, and if none of the things that I suspected turn out like I'm kind of going, I don't know. Yeah, scratch my head. Then I can honestly look at you and say, these are all the things that I looked at. It's not really hitting me here. I need to take what you've told me, and I need to spend a little time with it, and then
I call it marinating.
Do you? I forget what I call it. I do like marinating.
I don't put labs in immediately. I marinate on it and do it later after I've thought about it for a while.
Yeah. I don't think I call it marinating, but I might steal that from you. I don't know what I think I just always say my ADHD brain's
Marinating.
wild.
Marinating in the milieu.
But yeah, so yeah, if that's the only thing you get out of this,
advocate for yourself by being open, honest, and thorough.
Well, it's a good starting point for them too, because it makes them start thinking about things.
Yeah.
Mm-hmm. That is a great point.
That's a huge piece.
Okay.
Any other questions?
So people are not sending questions. I think we added most. I know.
We got most of it.
So
then I've got
no one
one
wants
thing.
to know what my favorite kind of pen is.
Actually, I'm interested. Is it?
I don't know.
How do you not know?
Because it's a feel thing. I don't look at the brand.
It's
not
probably
like something do you
it's
know how
probably
many
one of the
pens
ones-
I picked up on vacation?
It's probably one you steal from us. No, I'm just kidding.
It's not.
You
That's
don't
my
like our
second
G2?
favorite.
Okay, those are my second.
No, this has got a nice weight to it. It's kind of a little fatter.
I mean,
it just
there's-
feels
yeah.
good.
You gotta.
I don't. I stole it from somewhere, I'm sure.
Yeah,
but-
you need to figure it out because then you can get more of them.
Well, I can look at it. I just can't recall it. Because it's back on my desk.
Yeah, but you might lose it again. And then
I'll
how
find
can we
it.
help you? Well, I was gonna say we didn't have any more. One point I think to make is we were talking about all this self-advocacy, but how do you know when it's been successful? Like, how would someone know when they've advocated for themselves, they feel good?
Well, I feel like that's an easy answer. And you
But
just hit it on
for
the head.
some people, it might be, but some people don't have that internal sense. I think when you can leave, so I was going to say, like, some people don't have the, I don't know, the words are hard right now. They don't have that internal, like, feeling of comfort and knowing when they've gotten all their answers, the answers that they wanted. They can still have some, and you don't have the time. Because sometimes you're rushed.
Yeah.
How can you know that you still got what you needed and it's the right provider for you? And I think that's leaving, knowing, having a sense of, like, kind of calm
Yep.
about it, and knowing, like, a sense of peace about you got the most important things answered. Because you're not always going to get everything. You're not always going to get the answer you want. There sometimes is the I don't know, I need to think about it, we need to look a little bit more into it. That can be a little anxiety provoking, and you might feel like that wasn't successful.
I remember too that. So yes, number one, you leave with a much better feeling, call it a gut feeling or whatever.
Yeah.
You just have a sense of peace that you were heard.
And you're on the right
And
track.
you're on the right track.
Yeah.
The second is that you don't necessarily get that sense of peace about what you came in for, but you have a sense of peace that someone heard you and there's a plan in place.
Yes.
And there's
So,
follow up, and you're not just left free to go. It's a feeling. There's no way around it.
Yeah.
But but I think those two things hold true for whether you are a more anxious person or not. Because even the most anxious of people I have encountered, and then they walk out, and it's almost something you can visibly see.
Yes.
Oh, I
Like
see it
a
walking out the door.
relaxed- Yeah.
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 But yeah, and
And so that has to translate into a feeling. I'm not sure we can put words to that feeling
yeah,
for everyone.
but I think, yeah, that's what it is. It's hard. You want to feel, I think maybe I was thinking about it more from that if you didn't get a set answer.
Yeah.
Because sometimes you go into an appointment, it's like, you got an infection, here's your antibiotics, bye.
Right.
Or you got strep throat, here you go.
Well,
We
and
don't
maybe-
always have those answers, so then there's not always that definitive,
Maybe
here's
for
the-
those more anxious people, another gauge, so to speak, is that they leave with a complete relaxation that they know they can ask another, they can call
There-
back
yeah,
and ask
yeah.
a question.
Right.
They don't have that.
That I don't. Yeah.
I didn't get it all. What do I do? I didn't write this note or whatever.
I don't
But
want
they
to
have
call and
that
ask.
sense that it's just a sense of peace that they can call back and know that they're not being a bother and that they can get that
Yeah,
answer.
there you go. Just because sometimes I know I don't always have the answers, but I want that person to know that I'm working on it. There's a plan, next steps, and so sometimes that's how you know if you can leave knowing you got a good plan of action and your gut feels
Oh, you just
calmer.
tipped my brain because I was thinking about a patient in particular. We're back to advocacy, so it's an insertion, not necessarily.
Be
Anyway,
careful what you say in
Woo,
your field.
no, another way to advocate for yourself, and this plays a role. I've had patients tell me specifically, not very often, but when they do, it's incredibly helpful. I learn better visually. I learn better with
Yes.
data.
Yes.
I learn better. I really try
Yes.
to cater.
I do
If I
too.
don't know it up front, obviously, then I make a point of making sure that those future visits are done that way. Like I have one woman who can't always see her labs before she gets there, so I have them printed out and we go over them so that she can take notes on those labs. I didn't do that the first time because
You
it was
didn't know.
it was
Yeah.
easy labs. I was thinking they would be quick, but she said to me, she wrote back afterwards and said, "Please, can we have that stuff, in writing, because that's how I do better." That is a way to advocate for yourself,
That is a
and
perfect way to
Yes,
advocate.
it is.
Yeah.
ties in with when she left the next time.
You had it.
It was
yeah.
all good.
Oh,
Because when she left the first time, I got a really long email.
But she was a good.
But she wrote the email,
But
right?
yeah,
And
so
I was
she felt
so happy.
comfortable enough to reach out. Look, I love that too. I got an app on my phone. It's my favorite. It's the human body. I will show you I will show you what I think is going on, and I'm pointing it
I
out, and I
draw
love it.
pictures. I'm such a talented artist.
I mean, I try. I draw stick figures, but no, I will. Yes, if I'll immediately ask. Are you a visual learner? Are you XYZ? And if they say visual, I'm like, you want to see a picture? And I will pull it out. Because those things I do think are important, because especially with the human body, it can be very confusing when your pain is here, but I'm telling you it's coming from behind. How is it coming from my shoulder blade? And then I can show you where all of it connects. That can be very helpful. And then I also tell people too, I'm a talker. I will explain it to you. If you don't want me to explain it and it's too much, just tell me to shut up.
I have trouble with shutting up though.
I can, but I'll talk about something else.
I'm working on it.
But I do like to explain. So, and some of my clients will tell me, I don't really, as long as I feel better, I don't really care. And some are like, no, tell me. I want to know.
I don't find that as much. On
I don't
occasion
either.
I will, but
Most of my clients are like, no, I want to know. So,
Yeah.
then I'm happy to oblige.
well, because their outcomes typically are better than too.
They are.
But when people are leaving and I say, bye, have a great day and stuff, they're like,
Yeah.
they almost always say, we're on the right track, you know, we got a plan, we're on the right
And
track.
that's really all I want to hear.
And that's great.
Yes. I mean, that's what I want to hear.
Like when they say we, you know, I love that.
That is
That's
a
key.
Oh, we're
teamwork.
hearkening to the team.
Partnership.
Ooh, that was full circle.
Yeah.
I
There's
love
no
it.
I in team.
Love a theme.
I love it. That was only the closing thought I had though, was helping people know when they found their person. Because it can just be hard when there's not always a direct answer. Some disciplines are just way easier than others. Like saying you got the flu or strep throat, here's your medicine. It's a little easier.
Yeah, but
Selfishly, I don't think those would be as satisfying.
I don't know that they would either, but it's just,
I think where we live, people think they have to go to a big city to get good care. And you don't.
I would not disagree with that. I think that I could argue that a big city it could be worse though, because it's even more.
You just gotta find your.
That's
You
a
gotta find
phone
the right
call I
person.
would take.
Yeah.
If you don't know,
Yeah.
that is a phone call I could take, because there are some things I would say, nope, stay right here, you'll
Yes.
be in good
Yeah.
hands. And there are other things that I
Yes.
would say, no, please run for the hills.
100. Yeah.
And I will
100%.
be 100% honest with you.
Yeah. Same.
I mean, you've both been through medical stuff, so you know better than
Yeah.
you
there's
know what
certain-
you're talking about.
There's certain things.
Well, and
that-
we've both been on the receiving ends of people coming from the ivory tower of
Yeah,
medicine,
that are
UNC
not.
and Duke, and I'm like,
Yeah.
what the heck did they do to you up
Oh,
there?
my personal experience with neurology situation,
Yeah.
getting sent to Duke, and it's supposed to be the best, was, oh, well, we can't help you.
Well,
But that was it.
But
That was
let's be honest, it comes down
We don't
to,
know.
it doesn't matter where you're practicing, it doesn't matter what name you have behind you, it comes down to, do you have a provider that is willing to listen to you and be a part of a team?
Absolutely.
And I would caution you that in larger university teaching type settings, you are more likely to encounter folks that are not schooled in a team approach. And whether that's because they're new in the career, because it's a learning curve. Like,
Some of it is just the naive. You don't want to admit what you don't know.
Well,
what
I
you're
think you
doing.
said it in the beginning
Yeah.
that, like, when you were young, just starting
Yeah.
out, you didn't
Well-
want to say.
Well, you didn't want
I
people
knew
to.
it, yeah.
you didn't
you
want
knew-
people to think
Well, you
know what
knew
you're
you were
doing.
new because they're like, oh, this is our new grad, and you already know they're going, oh, new grad, you don't know. So then you don't want to say, I don't know.
My favorite was
But-
the first baby I was delivering.
Oh,
And
gosh.
someone in the room said, how many of you delivered? And the nurse piped in with, this is her first. I'm like, oh.
Right, you don't want that. But you with age comes wisdom. But I also am originally, I'm originally from Georgia, and I went to school in Atlanta, and I practiced just outside of Atlanta. And so I have learned in the big cities, and it was not always what it's cracked up to be. There are some very great places
No,
there.
I feel like I've gained
but-
valuable skills along my little
Yeah.
trek.
I was like, being
Trained in a big city. My first private practice was in Crunchy Granollaville in New Hampshire. And then kind of medium-sized town. You learn valuable
Yeah,
skills
so much.
everywhere, and I've encountered fantastic doctors in small places and big places, and vice versa. I have encountered people that there was a orthopedic surgeon in Raleigh that was supposed to be the best, and I ran screaming. Like, you don't know, and it takes you a bit. You can't decipher that over the phone or necessarily on a whatever their marketing plan is. Sometimes that takes a visit, but just know that don't judge a book by its cover.
Correct. Very, very true.
Because, I'm sure that guy was probably fine for some people and their needs. He was not fine for me.
He was not your cup of tea.
He was not my cup of tea. I do not think he ever crawled on the floor looking for a thing.
if he had, it might have changed things.
If he had, I might have viewed it differently. I saw myself as a problem fixer. The immediate problem was I had no favorite pen.
And all just seemed quite normal to me,
So
so I don't know what that says about me.
You're like,
I'm like, yeah.
She's dying
I'm
laughing.
in my head, I'm like, where's under the table? Did you go under your
It was
chair?
under the chair. It went under her chair.
And I would
too. Yeah,
like, could you, because then I would be like, could you please move your legs for a second? That would have been me. See, oh my gosh, yeah.
I see you're out there. You absolutely
I
know who
see
you are.
nothing wrong with this.
She didn't either, which was the. But I did take a pause to think. Oh.
Oh my gosh, we could go off on total tangents of some things. Like I've had some.
You think?
Look, one of my best stories. I gave one of my clients a wedgie by accident. It was
Ooh.
hilarious. He had a good sense of humor about it.
What was
Pretty
he?
funny. It was hilarious.
I've
And
never
then
given a guy a wedgie.
yeah, well, I didn't do it on purpose, but it was hilarious. And then he had such a good sense of humor. The next time he came back, he made a crack about it. It was good, but I've had some good experiences. So if you can laugh about giving it, and your client can laugh about you giving them a wedgie, you're good.
I mean, not to be okay. I'm gonna hit on a serious note, but because do not. I would hope those of you out in whatever Facebook land do not imply from our laid back approach that we can't be serious,
And
because we were both very capable
Yes.
of being serious when serious is necessary.
Mhm.
I tend to have the approach that everything's better when you can laugh both at yourself and puts everybody at a little bit more ease. And
Same. And laughter is actually quite good medicine.
absolutely,
When you're in
it's
pain,
not just a saying.
It's not. I mean, like if you can laugh as you're going through something difficult or dealing with pain, I will do anything I can to get you to laugh because it really does help the situation, and it kind of can take a little bit of that edge off and let you, the pressure, and let you relax a little. And,
I had people during my chemo months that were designated meme.
Heck yeah.
They had to send me memes so that I would laugh at least on a once or twice daily basis. Yeah, it's invaluable. Yeah,
but yes, we can
the
be
more
very serious.
inappropriate, the better.
And I will speak for Maribeth. She's very, very good at what she does. So she will figure it out.
Ditto to my friend Pauline.
So we will do our
ego
best.
stroking.
No, I just mean it. You're my doctor, and you've helped me in so many ways, and you listen and you care, and that is something that you don't find in every doctor. And like you said, I've been through it all, from Atlanta to Camilla to like other places. Yeah, VCU, going into Virginia. That's a big old hospital.
Well, and sometimes I think people who have to see multiple folks who are for whatever, whether they've moved around or they've not found their person. Each encounter you have, you find something good or bad,
Yes.
and it's equally as important to know. Yes, I'm looking for this, or I don't ever see that again. You gain that because it's getting you closer and closer to the person that's going to be able to best take care of you, whether it's physical therapy needs or medicinal needs or
Whatever.
house cleaning needs. I mean, I think that can be extrapolated.
No, and then this wasn't supposed to be like a infomercial, but I think that either Elite Rehab and Performance or Wellness for Women is a great place to start. So plug it.
I mean, I would not disagree with that because
Yeah.
we really are going to figure out what you need, and if it may not be us. Like, I mean, there are plenty of times where I'm like, you do not need me right yet. You might need me a little later, but here's where you need to go first.
Do you ever find yourself, again, confessional time, do you ever find yourself saying, oh, I wish there was a Pauline because I have a good question?
Yes. Yes. And the last 3 weeks was pretty darn not okay.
Mm-hmm. Sorry.
Yeah.
So you can't leave again.
I'm just kidding. But no, there are, because
There's
I love being able to bounce and like talk to you about things because you are such a great resource for me. So yes, I do find that all the time.
Yeah, did it. Absolutely.
Because and it's just fun too. Because we come up with things we never would have on our own, I think. You help me think
Well,
of things.
you like to do research a little bit deeper than I do.
I do love
But
it.
I like to come up with really good questions.
I know, and I love it. And I dig deeper.
You are a good team.
We are a good team. And I think I would say like the take, so kind of, because we got to wrap it up.
Do we?
But yeah, it's time.
Woo,
We're over.
6:05.
So wrapping it up though, I think the biggest take home I would say for me, and then you can give yours, is do not be afraid to stick up for yourself and to get the answers you need. Because even if you end up feeling like you're the difficult client or patient, whatever word you want to use, it doesn't matter as long as you get what you need.
Right.
So that's my kind of take home.
Yeah, I don't really have anything to add to that. Yeah.
I I'd rather be the squeaky wheel that gets the grease than the person that doesn't, than the wheel that doesn't. And falls
Squeaky
off.
wheel in terms of trying to
Yeah,
get
to get my
information for
answers.
yourself.
Yeah.
Yeah.
Advocate. That's the key.
Yeah,
Advocate.
it's think of it. You're advocating for yourself. You're not being too much.
If anyone has hung with us this long,
Thank you.
next month,
Yes.
next month we are talking about
What?
Ask Anything.
Oh gosh. All right.
Send
With
us
your
emails
questions.
in.
Okay.
Please send in questions. That's
Please.
kind of
Yeah,
my
the
favorite.
crazier the better.
Off the cuff is
This would be so
our
oh,
specialty.
Yes, this is gonna be so much fun, and
Yeah.
you're in for a treat if you send the question because it will be a
Did
great
we come
answer.
up with this topic because Kim is not with us? Because I don't think Kim would be as happy about that.
No, but
But we won't
We'll
tell
warm
her.
her to the idea.
We'll wait till the day of to tell her.
She will be equally as fantastic about it.
she actually, the notes that I print out, she usually
She
studies
does.
them
She
pretty
does.
good.
Yeah.
I like to come in unprepared.
Yeah, you two are pretty good off the cuff. But
I like
We
it.
hope that you in the listening world actually find some value to these because we enjoy ourselves, but our whole purpose is to try to get some more common, make the education and the information more commonplace.
And to help the community for
Yeah.
sure. So we will be posting this the video on the Elite Rehab and Performance YouTube channel. I'll have that up within the next day or two. Be patient.
We'll work on
Sometimes
it.
I forget, but I always get reminded. And if you need us in the meantime, you can reach us at Elite Rehab and Performance.
Wellness for Women, PLLC.com.
There you go. And we will be back next month. And this is going to be exciting.
Later, gamers.
oh, how do we do that?
I'm just going to stand here and stare at you.
I know. How do I stop it?
I don't know. You better,
Maybe take us off.
I don't typically edit these when I post them. So this will be on.
Girl, this might be a problem. I don't know how to